morning. It's Joe Morris here coming to you live on our Tuesday webinar series. We want to welcome you to the Agent's Advisor, theagentsadvisor.com. Each week we provide you a webinar at the 10 and 2 spot on Tuesdays. As a reminder, watch your emails on Mondays and Wednesdays as we do email follow-ups. Mondays the kickstart to your week, the Wednesdays the midweek review. And on Tuesdays, we're here for a live webinar to go over various topics that can help you grow your business and help you keep thriving in this awesome industry we're in. Also, as a reminder, every Friday is our Advisor TV, Advisor Radio day. That's where we shoot live from our studio in beautiful downtown Noblesville on the square. And we do a week in review segment, and then we'll do a guest interview segment. So as we get ready to launch that, we're excited about what our guest schedule looks like for this upcoming month. On the 11th, we'll have a great guest on talking about life settlements, and that'll be a great topic we'll get into. And you're going to like it because it's going to be a different twist in terms of life insurance contracts. So stay tuned and watch your email for that upcoming Advisor TV and Advisor Radio segment. For today, I want to walk you over here to our website. You can see the Agent's Advisor, and I hope that by now you've gotten used to it. If you haven't, please go to agentsadvisor.com and navigate our website. We're real proud of this website. We're still adding to it, bringing more content and information to you as well as products. And I think that when you take a look at it, you're going to see we have various offerings to offer you, whether it be pre-licensing, if you're bringing on new agents, or CE classes. We have our training webinar calendar, agent seminar calendar. We have an agency marketing side that we're going to open up to those agents that are linked to us. That's going to be a great toolbox for you. Everything from marketing, branding, website, social media platforms, pre-approach letters, scripts, ad slicks, anything to do with marketing, you're going to have that toolbox there to your benefit, and you can use it as you see fit to help you grow your business. For those of you that have had some challenges, whether it be taxes or need some background issues cleaned up, our tax help and legal services side, we endorse a few different options on that. Take a look at our tax help and legal service tab. Agency lending, if you're looking for working capital or you're thinking about buying a business and or book a business and you're wanting to grow your business that way, our agency lending source can help you in those areas as well. If you're looking to think, where am I going to be at in 2 or 3 years? I'm getting older in age. I'm ready to call it quits. I'm ready to retire, enjoy the good life. I want you to reach out to us and talk to me about that, because we've got some great programs for an agency succession planning system that we can help you retire out of your business. And if you're looking to grow professionally and pick up some new knowledge and experience all the while getting some designations, check out our professional designations tab. And lastly, I will tell you that if you go up to our resources tab and click on that, you're going to see some great resources for information. But if you want to outsource, you've got clients that are wanting to enroll in a health plan or Medicare Advantage or Part D, and that's not in your wheelhouse, that's not your specialty, or more importantly, you're not interested in being in that, I want you to check out MedPlan Network. It's a great outsourcing tool for you to refer clients and be protected on your core business with non-compete, and you get a chance to get referral fees off that business. If you're looking to branch out into the group market, you need help on group insurance or compliance, take a look at Benefit Resource Systems. They're very good at the small group, large group markets and compliance. And our other partner, Benetrust, for those large group cases or those cases that are looking at self-funding, Benetrust is a good source for TPA work in the self-funded markets. As for today, I want to get into the subject matter. And the subject matter of today is that we're going to talk about vertically integrating your insurance products and agency offerings. So welcome to today's webinar. You might ask, Joe, What's vertical integration? Well, vertical integration, in business school, I remember hearing the word vertical integration, not really knowing what it means, and I had to put it in my own mind what that really looks like. And if you've ever talked to me about this, I've always used the Walmart example. Let me give you the Walmart example. The Walmart example is a great story. Sam Walton was 44 years old when he started Walmart. And when he started Walmart, it was just a store down in Arkansas that was a general store. And if you all remember back in the day, and if you're young, you may not remember this, older folks might, but there were companies like 3D, some called it Danner's, Kmart, you've heard of Kmart, and other general department style stores that you'd walk into a store and it would have everything from goods to clothing and snacks. Well, Walmart gets into the market and they open up, as we all know, and they started their stores and just expanded and expanded. And as they kept expanding their stores with brick and mortar locations across the country, mostly in rural areas and in the big areas like the cities, they started to vertically integrate other products and services under their same roof. So if you think about the Walmart example that I give, vertical integration is simple. It's one of those things that when you're looking at your core book of business or your core business and your product or service offering, whether you're a financial planner, you're a CPA, an insurance agent, regardless if you specialize in just health insurance or you specialize in property and casualty or just life insurance or even financial planning and retirement planning, one common denominator from a Walmart example perspective is Walmart had the store. So once they got the traffic built up and people were taking advantage of their discounted pricing and the value that they were providing and providing quality goods at a discounted rate because they were buying in bulk, next thing you know, they open up other services. So first thing was the auto repair and service station. You could buy tires, get your oil changed, and then be inside the store shopping around while your car's being serviced. Next thing they opened up was the vision care center. Then they had the customer service where you could go and pay your utility bills, cash checks, buy money orders. Then they added grocery. Well, what's happened in the last few years is the Walmarts have added pharmacy. Now, why would they think about just a general store? I mean, if you would have asked somebody back 10, 15, 20 years ago, I'm going to Kmart to get my prescriptions. The common denominator was they had brick and mortar, one roof with one front door that people were coming into by the droves to get a better deal on their goods. And they had critical mass. So it only made sense for them, since they had all this traffic, they had all these customers, why not open up another vertically integrated business that people are buying these products or services anyway, integrate it into what? Under one roof. Now, am I suggesting that is Joe suggesting to you that you want to, if you're let's say a senior agent, meaning you sell Medicare products, that you're going to now open up a auto repair center? No. What I'm suggesting is vertically integrating other products and other services to your clients that you currently have. So how does that work in the insurance business? Well, it first works with knowledge. Having a general understanding that your customer they're buying other products and services. So if you're in the Medicare markets, it only makes sense that you're selling Part D drug plans. If you're in the Medicare markets, it only makes sense that you talk to them about other products such as hospital indemnity, cancer, dental, vision, and hearing. Now that might be so simple, right? Well, Joe, you're talking about all health insurance products. Yes, I am. That's simple. But why not talk about life insurance products? Final expense. Maybe there's a need for term or IULs. Let's say your client you've got as a senior and they've bought a policy, a whole life policy many years ago, or a UL policy, and it's sitting in their dresser drawer or in a shoebox in the closet. It's time to pull those policies out and see about the new kind of life insurance, right? Well, what about experience? Joe, I don't have the experience. I've never really done that. Well, you can get the experience, whether you learn on your own or you start doing it or you outsource it and team up with somebody that already has the experience, and you work in teams and you cross market. What are the products? Well, the products you'd be looking at, if you're talking about being in the Medicare market, would be adding dental, vision, and hearing plans, adding hospital indemnity plans, adding cancer plans, adding final expense plans. How about learn the annuity markets? People that are turning 65 or coming off a group plan, they might have a retirement plan, whether it be a 401k or a 403b if they're a teacher, or maybe other retirement plan options they've had. Maybe they did a self-directed IRA, or maybe they have their own investments on the side. It only makes sense that you have in your product portfolio the other products that you can sit with your client and talk to them about. Services. What maybe you might want to consider that if your client is a current client on the medical side, like Medicare supplement or a Part D drug plan or Medicare Advantage, what other services could you offer them? Well, a good start is helping them with claims, helping them find a provider. Now, I know that's a no-brainer. You're already doing that now, doing a drug lookup. When you're doing their Part D drug plans. I know you're doing that when you're finding their providers, so to make sure their providers are in network. But when you have a client, a service could be that when you move, let me know, because I can find the plan for you and I can find providers for you and guide you based upon where you're going to, based upon the network of providers in your current plan. There's a number of other services you can offer. Maybe it's not your service. Maybe you're not the one that's going to help them figure out their IRMA when they're turning 65. Maybe it's you're teaming up with their CPA or accountant who's already providing that service. And that's where you're developing networking circles. Other professionals in other disciplines, such as accountants, CPAs, or basic tax preparers, whether it be an elder law attorney. And those are just examples on the senior side. If you're a property and casualty agent and you're thinking about this, thinking, how do I vertically integrate more products? Well, if you're selling just auto and homeowners insurance and you're certain that you don't want to do Medicare Advantage, then you partner up with somebody, maybe it's MedPlan Network, to be that networking circle or that center of influence for you to help your clients and create more value. What are centers of influence? In your community, finding those people such as the mortgage broker, the real estate agent, the property and casualty agent, the accountants, the attorneys. Those are centers of influence that you would want to network with, make them part of your circle. And I'm not talking about showing up at a networking event where everybody's bringing out their new business cards and passing amongst one another. I'm talking about a genuine, true networking circle, a true center of influence. So let me give you an example. As you're sitting with your client and you're going over their options for their insurance needs, and we're going to talk specifically health insurance needs. As you know, in the under 65 market, the most intimate question you can ask a person isn't their medical information, it's how much money do you make? Because a person's modified adjusted gross income today determines how much they pay for health insurance today, right? With the subsidies. When you've got a client that's turning 63, their income at age 63 is going to determine at age 65 how much they're paying for their Part B and Part D premiums, right? You understand IRMA. If you don't, we'll talk about it another time. My point in this is, as you're determining what their income is, a great question is this: who does your taxes? They might say, well, I do. Great. Do you do them on your own? Then you understand modified adjusted gross income. Okay. Or they might say, and I hope they say, well, I go to H&R Block, or I go to Liberty Tax, or I go to an accountant. Great. What's their name? What's that person's name that prepares your taxes? Well, why do you ask, Joe? The reason I ask is we have a mutual client. You're our mutual client. And what we put together for you today, I think it's important for them to know, because your income determines what you pay for health insurance. Now, most people don't look at it from that perspective. I think it's a good way to look at it from the standpoint it is true that a person's income determines how much they pay for their health insurance now. Now, does it affect what they pay for an Advantage plan? Possibly. Maybe they're dual eligible. Maybe they're on Medicaid. Maybe they get a low income subsidy. Or maybe they are a higher earner, and maybe they did make more money at age 63, but now at age 65 they don't. Maybe they need to relook at what they're paying for their Part B or Part D. If they have an attorney who handles maybe a will or an estate or a trust for them, it's important for you to know that, because one, it builds your networking circle. Two, they're a center of influence. And three, you have a common bond. You have the same client. My point in bringing that up is when you have that center of influence of these other like professionals and you reach out to them, that's going to bring to you a couple things. One, it's going to bring to you a commonality with that other professional. Now you're not some cheesy insurance agent. Now you're another professional, another like professional, providing a valuable product, a valuable service to a common client. That common client is their client. So when you bring to them, Mr. Accountant, Mr. Attorney, we have a mutual client. When you make that phone call and say, we have a mutual client I think we need to talk about, I'd like to meet with you, when's a good time? I want to share with you what we've put together for them so you know. You meet that other like professional and you show them what you've done for the client, our client as we would call it. And then you say, and by the way, if you have other clients that could use our products or services, please let me know. Here are my cards. The reason I bring this up is so many people think it's very difficult to create lead generation and have it. When I've been asked countless times, what kind of lead program do you have? My immediate response has always been, you want the old kind of lead program or the new kind of lead program? And I usually get a chuckle because they're like, well, what's the difference? Well, the difference is the old kind of lead program is you get up every morning, put on nice clothes, and talk to people. The new kind is you sit at home, you're waiting for a lead drop to fall that you're going to spend $400 or $500 for to do a 1,000-piece mailer, and you're going to cross your fingers that the rep told you that you're going to get a 1.5–2% return. So on a 1,000-piece mailer, you're going to get 15 to 20 leads. What I'm suggesting is there's nothing wrong with those programs. We promote them. We believe in them. I'm suggesting that while that's working for you, that you are talking to the accountant or the attorney or the property and casualty agent or the financial advisor about who you are and what you do, because you have what? You have the knowledge, that's 3A. You have the experience, that's 3B. You have the products, that's 3C. And you have the services, that's 3D. You have the tools, you have the value. But what they have that you don't, the average accountant will file 500 personal returns. Now, is that a stat? You can fact check me on this if you want. That's just been my experience in working with accountants over the years. Working with accountants, the average accountant was doing about 500 filings, individual filings, and had about 50 businesses that they were managing. So when you look at if the average accountant has about 500 filings a year, and just do the math, if the average accountant is doing 500 filings at $150 a filing, that's about a $75,000 revenue stream for them. Nothing wrong with that. Good for them. But if that's just the average, then if they've got 500 filings, how many of those 500 filings are turning 65? 5%? 10%? I don't know. If it's 5%, that's 25 leads for just Medicare alone. If they've got 50 businesses that they're managing their taxes for, if you got 5% or 10% referred to you to do a group health plan, that could be 2 to 5 groups a year. So how many accountants and CPAs would you need to network with to grow your business, and maybe generate an extra 30, 50 grand a year. My point is, by having those networking circles and centers of influence, and you're vertically integrating knowledge, experience, products, and services with another center of influence, another network of other like professionals, you're going to have at your disposal, however hard you want to work, a plethora of leads, especially if you've got the 3A right here, the knowledge, the 3B, the experience, the 3C, the products, and the 3D, the services. Now, what do you do under this vertical integration, how it's working within your insurance business? Cross-selling to existing clients. So as you build this rapport with your networking circle, your centers of influence, and you're cross-selling to your existing clients these other products, I haven't said it yet, but are you seeing a trend here? We're talking about working efficiently. We're talking about having to see fewer clients and driving more revenue. We're talking about networking and spending less on marketing and more on selling. Also jumping into new markets. How do you jump into new markets? Well, at the Agent's Advisor, we really believe that in order to be an agency builder, in order to really be driving sales and growing strategically, growing into new markets might be as simple as leveraging your client base and your prospect base and who you are within your community and within your business, leveraging that with MedPlan Network, Benefit Resource Systems, and or Benetrust. You can go into new markets with those companies. They're all vertically integrated to the Agent's Advisor. You can grow into new markets by doing what I mentioned earlier, your networking circle and your centers of influence, by getting into new markets based upon their markets. So that's where vertical integration comes into play. It's not just one thing. It's a myriad of things that's all connected to one thing: your customer. Your customer. Your customer is buying products and services from other individuals and other entities. Now, if it's an entity like a Walmart, that's a difficult proposition. If it's an individual like an accountant, attorney, if it's they're buying their auto and homeowners from an individual agent, they're getting financial planning advice from a financial advisor, those four centers of influence can bring you into new markets. And if you have a question and you need help and support, then you've got a resource that's vertically linked to the Agent's Advisor. So how do you get started today on this? How do you do this? Well, first you learn new ways to integrate new products and services to your existing clients. Last week I did the win-win senior solution. For some of you that might have been new, but anybody that's worked with me for the last 7 years, they know that that's not new. So that's something interesting. When you look at that program in itself, we're talking about comparing a MedSup plan to a Med Advantage plan and how we're adding in all the products to fill in the gap. If you look at being a connector, that's how you get started. You're a connector. So how are you a connector? You're a connector by connecting with other centers of influence and other people. So if you happen to be involved in your local Little League or your daughter's dance club or your son's rugby team, you're a connector of people, because typically you're going to meet the parents, and the parents are working just like you and I are, and you're going to connect people. I use the phrase a lot, I got a guy. When you look at the Agent's Advisor, the legal help and tax advice, that's because I got a guy. I've used them personally. That's why I support them, because they help me. When you work with this on a local level, being a connector, and that is you become an influencer. By being a connector, you're connecting other people, and you're really helping not only them individually, but you're helping your community, you're helping your local economy by being a connector of people. And it's no different if it's, you got a guy that's great working on cars. You got a guy that's great with HVAC, a home repair guy, a contractor, a guy that sells cars. You need office supplies. You need office equipment. Whatever it might be, you're connecting people now. Well, now by being a connector, you're going to then turn that on the other side, and they're going to be a connector for you. And by being a connector, your reputation will follow that by solving other people's problems, not literally, but indirectly by connecting. And then you become an influencer. You want to be a solutions provider to your network of centers, or your networking circles, Being a solutions provider to your networking circles, meaning you're a solutions guy, because that accountant, that CPA, that property and casualty agent, that financial advisor, you're going to find a solution, because I promise you, and I just had this happen yesterday, you're going to make a phone call to them, and you're going to tell them about who you are, what you do, and the commonality by having a like client. They're going to say, hey, I was just talking to another client. You think you can help on this? Because they're going to be able to say, I got a guy, I got a gal, I got a person that can handle this. Be a problem solver to your centers of influence. Help them solve their own problem, whether it be on their medical plan or their group plan, or they have an issue with a claim. Be a problem solver for them. By doing so, you're going to vertically integrate all your products and services that are alignable. Alignable meaning your products need to be alignable to your core product. So like when I talk about in the win-win senior solution, those products are vertically integrated because they're alignable. Health plans have gaps, whether it be a Medicare Advantage plan with hospital confinement copays. Boom, GTL's Advantage Plus. They have a high out-of-pocket exposure with high out-of-pocket maximums, like $6,700 on an Advantage plan. Boom, critical illness. It doesn't, typically they don't cover dental and vision, at least not comprehensive. Boom, a dental vision hearing plan. It doesn't cover life insurance. Boom, final expense. How about skilled nursing, assisted living, home health care? Boom, short-term care or long-term care. If you're in the under 65 markets, you've got others, such as disability income. I just had a meeting this morning before this webinar, working with the people in my office and that own the building. And I got asked, hey, do you guys do disability insurance? Yeah. Great, I need to come in and see you. Do you guys do life insurance? Yeah. Great, I need to come in and see you. How awesome is that? That's great. Now, I believe it's very, very important to choose an upline that is providing true strategic planning solutions, such as business development, professional designations, and agency building strategies. And I'm not talking about agency building in the truest sense where you're going to go out and recruit a bunch of neophyte agents or bring people in. I'm talking about true business development, true strategic marketing with your everything from your business card to your website to your social media platform, to lead generation, to quality of products, services, and more importantly, the professional knowledge that you'll have by gaining experience and using designations and using these strategies specific to a particular market. And I say that if you're in the senior market, for example, selling Medicare, if that's your wheelhouse, then you're gearing up for an opportunity that during AEP, the annual election period, October 15th through December 7th, you're just taking a break right now. You're relaxing because you know come July certifications open up and then you're getting ready to go to market. Well, if you're a financial planner, you're working all year round. If you're a property and casualty agent, you're working all year round. If you're a group agent, you sell group benefits, then you're getting ready because usually renewals come 2 times, really on, I'm not saying every time, but generally speaking, July 1st are typically renewals, October and January 1st. So when we get into this fall season, it's all about the open enrollment. plans changed, renewals are coming up. Now you're doing RFPs, you're getting renewals 60, 90 days out, trying to find a strategy or a plan. My idea is I think that you could get into this and choose an upline that's really going to help you personalize your strategic plan on how you're going to go to market today moving forward. I want you to give us a call and call us for our agency marketing solution. It's a tab on our website. If you're linked to us, we got some great tools for you. You've seen what we've built out on the Agents Advisors website and our social media platforms. You've seen what we've built out on MedPlan Network with our website and our social media platforms. You're seeing what we're doing with Benefit Resource Systems with our website and agency platform there with the social media side and all the solutions there. We can do the same for you. It's not just about the products. Yes, we have the products. Yes, we have quoting tools, forms engines. We have that. Yes, we've got the commission schedules to help you in that sense. But it's beyond that. It's much, much more than that. We're going to be able to help you with a true strategic plan to grow your business. That's the whole essence of the Agent's Advisor. We want to be your advisor and coach you to the level that you see yourself at and beyond. I want to thank you for attending. Please reach out to us. If you have any questions, don't hesitate to give us a call. Our number will show up here on the screen, but our number is 877-886-4829. You can email us at info@theagentsadvisor.com. Visit us on the web at theagentsadvisor.com. I look forward to talking to you again. I'll see you next week on this live webinar. And as always, make it a great day.